South Africa might not be able to reach its 2030 goal of ending new HIV infections if there are still men who refuse to test for HIV, and lack of funding to effectively drive HIV and AIDS awareness campaign is also a stumbling block. That's according to civil society groups and community-based organizations. They say this year's theme, Let Communities Lead, may sound good, but without resources, community outreach programs cannot be effectively implemented. Sakile Xaba, who's been living with the virus for over 20 years, says men must take charge of their health.
The biggest challenge that we have in HIV in South Africa, it's men who don't want to accept their status, it's men who don't want to go to the clinic and get tested. So I'm encouraging the men of South Africa to go to the clinics and get tested for HIV so that we could eradicate HIV and new infections, because as a country we have a vision of 2030 of zero new infections. But if men don't want to test, if men don't want to take their ARVs, if men don't want to know their status, then we will not be able to reach that goal as a country.
UNICEF says children who should be receiving HIV treatment must be prioritized.
We need to put emphasis on finding those children in the community who are not on treatment. We need to put emphasis on the vulnerability of young girls who get pregnant, who are violated, abused. We need to make sure that the prevention of mother-to-child transmission in young women through breastfeeding is under control.
Deputy President Paul Mashatile has urged communities, especially men, to play their part in protecting children from sexual predators.
We are concerned with HIV treatment gaps in children. Children living with HIV aged 15 years and below are left behind in the global HIV response when compared to the general population. Globally, only 52% of children who are living with HIV are on life-saving treatment, compared to 76% of the adult population. So we are leaving children behind.
Health Minister Dr. Joe Phaahla says the country is struggling with keeping people on treatment. However, the U equals U, which is undetectable equals untransmittable, is one of the key interventions that will assist government with treatment initiation and retention. I'm Nonhlakani Pumakwaza for SABC News, Mandeni.